170 million Americans are registered organ donors. Well, this morning, some in Congress say the public trust in the donation system is eroded after reports that dozens of supposedly dead donors actually showed signs of life. And now reform is on the table. NewsNation weekend anchor Anna Kooiman joins us now. I mean, Anna, this elicits some really disturbing, visuals. What in the world is going on here, and how big of a problem is this?
Yeah, a lot of people looking at their licenses going, am I an organ donor? Let me double check here. The United States organ transplant system really looks to be in need of an overhaul. This comes after multiple accounts of close calls where patients' organs were almost harvested accidentally while they were still alive. Lawmakers on Capitol Hill Tuesday talking about results of a federal investigation and what they say is a need to protect people who plan to donate their organs. But of course, we all want to be fully dead first. That Health Resources and Services Administration's investigation was initiated last year after a 2021 case in Kentucky where a man was believed to be brain dead from an overdose, but doctors were wrong and surgery was called off just moments before he was taken off life support. A physician noticed the man moving and moaning while being taken to an operating room. Well, the man did survive all of this. And now Health and Human Services is announcing they want to improve the organ transplant system. Secretary Robert F. Kennedy Jr. saying the organ procurement organizations that coordinate access to transplants will be held accountable. The entire system must be fixed to ensure that every potential donor's life is treated with the sanctity it deserves. The HRSA investigation finding there were more than 350 cases where organ donations were approved but then canceled, sometimes at the last minute. And they all got a closer look. Nearly a third were of concern. That's including 73 cases where the doctors signed off for organ retrieval, but the patient wasn't fully dead.
There were clearly some things that happened that I think could constitute euthanasia. I mean, if the patient's dying, but they take the patient's organs before they die, that's euthanasia. We want to make sure that the American public knows that if they are willing to become an organ donor, they're going to be treated humanely and legally, and that the family's wishes will be respected.
I mean, of course. Among the things determined in the report was that donors hadn't had proper neurological assessments, consent practices were questionable, Markie, and some patients' cause of death were not classified correctly.
Yeah, organ donation is such a beautiful and life-changing thing, and for those of us who have checked that box, you want to make sure that it's done right. Anna Kooiman, thanks so much. Remember, everybody, you can catch Anna Kooiman every weekend, 1 p.m. Eastern, 12 noon Central.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.